بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about adrenal calcification. In this short talk, I will discuss the common causes and some examples of these common causes. Adrenal calcification is not a rare finding in healthy asymptomatic people and usually the result of previous hemorrhage or infection like TB or histoplasmosis. Causes: hemorrhage, infection, adrenal tumor, others like Addison disease, Wallman disease. Radiographic feature: adrenal calcification is best assessed on CT scan, where it can be differentiated from a calcified adrenal mass or lesion. CT also allows simultaneous characterization of any underlying lesions with size, density enhancement, and washout. Here, this calcification can be seen in the Blenheim film. Here, this is a child with bilateral adrenal calcification and enlargement of adrenal glands. The left one is larger than the right one. Here, this is an ultrasound of two patients with calcification. Here we can see curvilinear calcification in a patient with a cyst or pseudocyst, and here we have cross calcification in the region of the right adrenal gland with shadowing. Here a CT scan shows calcification of the right adrenal gland, and this is incidental. And this type of calcification, it is difficult to be seen in the Blenheim film and even in ultrasound. In children, we should suspect in neuroblastoma as a commonest calcified adrenal mass. In adults, calcified cyst has been reported as a common adrenal mass, characteristically showing peripheral curvilinear calcification, as we will see in some examples. Hemorrhage can be a result from the sepsis, like in Waterhouse-Friderichsen syndrome, plantar trauma, adrenal pseudocyst, neonatal asphyxia, coagulopathy, infants calcification seen after the hemorrhage as early as 1 to 2 weeks. Radiology: post-hemorrhage calcification is usually seen after initial adrenal hematoma has resolved, and hence is not usually seen with adrenal lesion. However, adrenal metastasis such as from bronchogenic tumor can present with hemorrhage, making the diagnosis challenging. Here we see patient with curvilinear calcification in the region of the adrenal gland, and here this is the Blenheim film of this patient with curvilinear calcification, and here it is a calcified cyst. Here another patient with curvilinear calcification involving the right adrenal gland with acoustic enhancement. Here, with the same patient has a CT scan, and we see the curvilinear calcification and cystic component or water attenuation component of the right adrenal cyst due to hemorrhage or pseudocyst. Here, another thick calcification noted on the left adrenal gland due to pseudocyst. Here, another patient with heavy calcification involving the left adrenal gland on enhanced CT scan, probably due to prior to hemorrhage. However, infection can be in the differential diagnosis, and we see the calcification is on the wall. Infection like TB, histoplasmosis are common. Granulomatous disease causes adrenal gland calcification. Here we have a blame film patient with bilateral adrenal calcification, incidentally uh, discovered and proved to be patient has TB. Here, this is another patient with bilateral adrenal calcification, and we see the patient has granulomatous disease as diagnosed later. Adrenal tumor can present with calcification like adrenal metastasis, especially from melanoma, or primary adrenal tumor like neuroblastoma, adrenal myelolipoma, adrenal adenoma, adrenocortical carcinoma, and pheochromocytoma. Let us see some example. Here is a child, 3 years old, with calcification in the right adrenal region located posteriorly, and this cause calcification most likely due to adrenal neuroblastoma. And here we see the CT scan of this patient with calcification in the right adrenal gland with some necrosis. And here this is the coronal reconstructed images and sagittal reconstructed images of this patient with calcified neuroblastoma. Here another patient with large mass in the left adrenal gland, pushing the kidney posteriorly and the pancreas anteriorly, and this proved to be a neuroblastoma from the left adrenal gland. Here another patient with bilateral adrenal masses with calcification proved to be adrenal leiomyomas. Here, this is another patient with left adrenal mass with calcification, and this is proved to be a primary adrenal teratoma. Other causes of adrenal calcification, like in Addison disease, and it is uncommon, and it is suggest underlying cause like infection, and also another cause or another rare cause of adrenal calcification is Wolman disease. Here, patient with bilateral adrenal calcification, and we see the right adrenal gland and left adrenal gland, and this enlargement of the adrenal gland, and this is Wolman disease or primary familial xanthomatosis, and this is storage disease, rare autosomal recessive inborn error of metabolism resulting in deposition of fat in multiple organs, and the patient presented typically with the first 2 months of life, failure to thrive, diarrhea, and vomiting associated with hepatomegaly, splenomegaly, and generalized lymphadenopathy. Here, another patient with enlargement of adrenal gland with Wolman disease, and we see the triangular shape of the calcified adrenal gland. Here, another patient with Addison disease, and we see the calcification of both adrenal glands. This is the right one, and this is the left one. And this patient with Addison disease. And the patient has accessory spleen here. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.